I hope everyone can hear. How many students are there in the class? Okay.
Ma'am, 15.
So you drop a message in the group, tell them to join the class.
Okay, ma'am.
Okay, so I'll start with the class and then I'll leave you early. Okay? Is everybody okay?
Okay, ma'am.
It's okay, let them join. Okay? So first of all, before going into vaccines or before going into the vaccination, okay, pehle we have to understand what is immunization. Okay, so there is one thing we call it as active immunity and the other is passive immunity. Okay, so every individual should have a good immunity or they should have a good immune response in the body. Okay, so whenever there is any infection, it can be because of bacteria or virus or fungi, okay, or any microorganism. Whenever whenever a microorganism enters into the body, okay, our body will start functioning. Okay, that is हमारी जो antibodies है they will start doing their action, that is by attacking the antigens. Okay, they will start attacking or they will start destroying the antigens or the microorganism. Okay, so so that is called the antibody antigen response. Okay, so when that happens, okay, so so there should be enough of antibodies in our body, and in that condition we can say that the immune system of the patient is good. Okay, so that is why there are two important immunities in immunization. One is active immunity and the other is passive immunity. In active immunity, it occurs when the natural immune system of the body develops immunity on exposure to antigen. So that is why I'm saying that whenever there is any microorganism in the body, it can be bacteria or it can be viral infection. Okay. So what happens is our body, inside our body, we have antibodies. So these antibodies, they will be active, they will start doing their work and they will attack the antigens. So this procedure, we call it as active immunity. Okay. So some people who are having good immune system, okay, their antibodies, whenever there is an infection in their body, the antibodies will do the action. But what happens is sometimes people who have low immunity, okay, so uh, because of low immunity, the antibodies also are low. So in such cases, we have to give something which we can compensate. Okay, so उसको बोलते हैं passive immunity. So it is the administration of antibodies or serum containing antibodies to provide immunity against specific organisms. Okay, so because the immune system of the patient is very low, okay, antibodies the production here that is very low, so we need something from outside and we have to give to the patient. Okay, we need to administer something, we can administer extra antibodies into the patient so that they will attack the antigens. Okay, so that process is called passive immunity. Okay, is this clear with the two types of immunity? Anybody has any doubt? Just student second years.
No, ma'am.
Okay. So, like I said, that active, first of all, is the active immunity. Okay, so it occurs when the natural immune system of the body, so this occurs naturally. Okay, so whenever there is an antigen in our body, our antibodies will be active and they will attack the antigen. So that is called as the antigen antibody response. Okay, and this whole procedure we call it as active immunity. Then now coming to the vaccines. Okay, so you know that now because of COVID-19, okay, so we have many vaccines. We have many countries are producing many vaccines. Okay, so in India we have Covishield, we have Covaxin. Okay, and other countries, in the Western countries, they have Pfizer, they have Moderna. Okay, they have Sputnik. So there's so many vaccines that are being produced. Okay, that are being yeah, manufactured. Okay, and they're being distributed to all over the world. Okay, so these vaccines are very important. Okay, why? Because through these vaccines, it will, there will be more antibody and the immune system of the patient will be better. So what are vaccines? It is an immunobiological substance designed to produce specific protection against any given disease. Okay, so not only coronavirus, it can be tuberculosis. Okay, so or it can be hepatitis or any disease condition. So uh, to fight against those infections, we have to give some vaccines. Okay, we have to give some that can produce antibodies inside the body. So this will stimulate, the vaccines will stimulate the production of protective antibodies and other immune mechanisms. Okay, so that is why vaccines are very important. Okay, so because they help in producing the antibodies inside the body, and that is why immune system of the patient will be good. So that was about vaccines. Now there are types of vaccines. One is the live attenuated vaccine. Okay. Number two, we call it as the inactivated or the killed vaccine. Then third type is the toxoid. Fourth type is the cellular fraction. And the last is the combination. Combination, it can be combination of live vaccine and combination of killed vaccine together. Live and killed also can be given together. Or it can be a combination of live vaccine and toxoid. Okay, so that is a combination. So these are the five types of vaccine: live vaccine, killed vaccine, toxoid, cellular fraction, and combination. So first of all, let us see what are live vaccine. Okay, so live vaccine, live का मतलब है जिंदा. Okay, so if you are making any vaccine from a live organism, or you can say from a live virus or a live bacteria, so that we call it as live attenuated vaccine. So live attenuated vaccines are prepared from live organism. Okay, not from a dead or killed microorganism, but they are prepared from a live, okay, microorganism which is still alive. For examples of vaccines are BCG. Okay, we have BCG, then for typhoid oral, then bacteria. This is a bacterial BCG and typhoid oral. This is from the bacterial microorganism. Then oral polio, yellow fever, measles, rubella, mumps, chickenpox vaccine, influenza vaccine. This is a viral. Okay, so there are bacterial vaccines and there are viral vaccines. इसका मतलब है that is the vaccines are made from the live bacteria or the vaccines are made from the live virus. Okay, from the live virus we have oral polio, there is yellow fever, there is measles, MMR, measles, mumps, rubella, chickenpox vaccine, influenza vaccine. Okay, so these are made from the live virus. Whereas from the bacteria, there is a BCG, okay, where we can give to prevent the tuberculosis. Okay, so BCG vaccine, typhoid vaccine, okay, which is an oral form. These are bacterial vaccine, means that they are made from a live bacteria. Okay, so these are some of the examples of live vaccines. Now coming to the second type, that is a killed vaccine, means that vaccines are made from the killed or dead vaccines. Okay, so these organisms, the microorganism, it can be bacteria, it can be virus, or it can be fungi. So these organisms are killed or destroyed by heat or chemicals. When infected into the body, they stimulate the active immunity. Okay, so these microorganisms, first they are being killed by which process? By chemicals or by using heat. Okay, and then these killed vaccines, when they are infected, Okay, when they are going into the body, then they will stimulate active immunity. So they are safe, but they are less efficacious than live vaccine. So which is more better, which is more beneficial, or which is more effective? It is a live vaccine as compared to killed vaccine. Okay, but which is more safe? Okay, which vaccine is more safe? It is the killed vaccine. Okay, so some examples of killed vaccine can be typhoid, cholera, pertussis, okay, meningitis, plague. Okay, so these are from the bacteria. Okay, these are made from the bacteria organism, and from the virus like rabies, polio, hepatitis A, hepatitis B, etc. Okay, so these are made from the killed virus. Okay, so this is about the inactivated or killed vaccine. Okay, is there any doubts with live and killed vaccine? Anybody has any problem? Second years, any doubts?
No, ma'am.
Okay. So now going to the third type of vaccine, that is a toxoid. Okay, so certain organisms they produce exotoxins. Okay, so these microorganisms, it can be bacteria or virus. Okay, so they produce some poisonous waste. We call it as toxins. Okay, so they produce exotoxins, and these toxins are detoxicated and they are used in the preparation of vaccine. Okay, so bacteria or virus or fungi. Okay, so they themselves they produce some toxins. Okay, they are releasing some waste, you can say. Okay, so when they are releasing these waste, we call it as exotoxins. Okay, so so as a scientist, we are taking these exotoxins and we are preparing for a vaccine. Okay, so we are using those toxins which are released by the microorganism, then we prepare it in the lab and we make it for a vaccine. Okay, so those are called as toxoids. Okay, so these toxoids are highly efficacious, means they are highly effective, they are very beneficial for the patient. Okay, it improves the immunity of the patient, and also they are very safe as compared to live vaccines and killed vaccines. Okay, so a very good example of toxoid is TT, tetanus toxoid. You must have heard about tetanus toxoid TT injection. Okay, so this is a vaccine. Okay, and this which type of vaccine it is? It is the toxoid. Okay, and another example of toxoid is the DPT, diphtheria. Okay, diphtheria pertussis toxoid. Okay, so this DPT is also a type of toxoid. Okay, so these are the two examples of toxoid vaccines: tetanus toxoid and DPT. Okay. So this is the third type of vaccine. Now coming to the fourth type, that is the cellular fraction. So these vaccines are prepared from extracted cellular fractions, means that from particular cells. Okay, and the duration of experience is limited, but their efficacy and their safety is very high. Okay, so how much beneficial is it for the patient? It is very good. Okay, it is very effective for the patient. It is very beneficial, and it is very safe for the patient. Okay, but the duration of experience means that they are not properly used in public. Okay, so the duration of experience is still limited, means that it is not being used widely in the world. Okay, so that is the disadvantage. But their advantage is that it is very, very effective, very, very good, and it is very safe. Okay, so such examples of vaccines are meningococcal vaccine, then there is a pneumococcal vaccine for pneumonia. Then we have the hepatitis B polypeptide vaccine. Okay, so these three vaccines are a type of cellular fraction vaccine, okay, which are produced from specific or extracted cellular fraction. So this is the fourth type of vaccine. Now coming to the fifth type, that is a combination. So I said that we can combine live vaccine and also kill vaccine, or we can use it as a mixed vaccine. So in combination, if more than one kind of agent is included in the vaccine, then we call it as mixed or combined vaccine. It means that if you are using live and killed vaccine together, or if you are using live and cellular fraction vaccines together, or toxoid and killed vaccines together, then those vaccines we call it as a combination vaccine. So example like DPT, okay, D is for diphtheria, pertussis, and tetanus. So here we are combining diphtheria, pertussis, and also with tetanus toxoid. Okay, so we are combining these three. Then in DT we have diphtheria and tetanus. Okay, so we are combining diphtheria and also the tetanus toxoid. So these are the two different types of vaccines. Okay, but we are still combining together and we are forming a one vaccine. Then we have hepatitis A and hepatitis B. Okay, and also we can mix hepatitis A and typhoid vaccine. Okay, so these are the combination, or we can say the mixed vaccines. Okay, so and this is also the fifth type of vaccine. Okay, so is it clear to here with all the types of vaccine with live, killed, toxoid, cellular fraction, and combination fraction? Okay, so there are basically 5 types of vaccine. Anybody has any doubts still here?
No, ma'am.
Okay, so if you are giving vaccines to the patient, okay, so there can be some side effects. Okay, so first of all, there can be pain in the injection site. Wherever you're giving the injection, wherever you're giving the vaccine, it can be on the left side of the arm, or it can be on the thighs, it can be on the arms, on the extremities. Then there will be a pain. Okay, so first of all, there will be pain at the injection site. There can be swelling and there can be redness. Then patient can have mild fever, or patient can have shivering, feeling cold. Patient can have fatigue, very tired, very weak. Okay, you just feel like you want to crash in the bed. Okay, so that is called fatigue. That is you are feeling very tired. Your body just feels like you just want to sleep and do nothing. Okay, so that is fatigue. And patient can have headache, severe headache, and also muscle pain and joint pain. So these are some of the common side effects of any vaccine. Okay, not specific vaccine, but in general. Okay, so the commonly used vaccines, okay, that we have in the universal immunization chart. Okay, so first of all, okay, so you can see in this picture there are columns here. Okay, so there is a column for vaccine, okay, the types of vaccine, then the type of agent, okay, the type of vaccine, is it live or is it killed, inactivated or killed, or is it toxoid, okay, then route of administration, how we should give these vaccines, is it by intradermal, okay, or should we give by subcutaneous, or we should give IM, that is through the muscles. Then primary immunization, when we should give, okay, when should we give these doses, is it at birth, or which year or which months, okay, or which week. Then booster dose means the first dose, and the indication means we can give in children or in adults or in old people or senior citizens. Okay, so first of all we come to the vaccine. The first type of vaccine is the BCG. Okay, BCG का full form क्या है? Bacille Calmette Guerin. Okay, so BCG, it is a live attenuated vaccine. Live attenuated vaccine का मतलब है made out from a live microorganism. Okay, so we are making, so this BCG is made from a live bacteria. Okay, so the route of administration, we give BCG by subcutaneous or intradermal. Then we give BCG at birth, okay, and the booster dose 7 to 14 years. And indication in all children, okay, in all children, irrespective of their race, okay, irrespective of their religion, okay, all children. Then second is cholera. Cholera, it is an inactivated, means that it is made out or it is produced from a, this type of vaccine is made from a dead virus or a dead bacteria. Okay. So the route of administration is subcutaneous or IM. Primary immunization in adults, 2 doses, 1 month apart. Okay, so we have to give 2 doses of cholera, but the duration or the gap between the 2 doses is 1 month. Then the booster dose every 6 months, endemic areas. Indication, people living in endemic areas. Okay, endemic areas means where there is a high risk for people getting cholera. Then third type vaccine is diphtheria. Diphtheria is a toxoid vaccine. We can give diphtheria by IM. Okay, primary immunization we have to give at 6 weeks, 10 weeks, and 14 weeks for the babies. Booster dose 18 months and 4 to 6 years, and indication for all children. Then pertussis. Pertussis is an inactivated. Okay, so keep it in mind. Okay, so uh, diphtheria, pertussis, and tetanus. This is a mixed vaccine. Okay, it is in combination. So diphtheria, pertussis, and tetanus. These are different types of vaccine. Okay, so diphtheria is a toxoid, pertussis is inactivated or killed vaccine, and tetanus is a toxoid. Okay, so diphtheria and tetanus are both toxoid. Okay, so diphtheria is a toxoid. Okay, and pertussis is also inactivated vaccine. This is also given at IM. We give it at 6, 10, and 14 weeks of age. And booster dose is 18 months and at 4 to 6 years. And this is also given for children. Then tetanus. Tetanus is a toxoid vaccine. We give it through IM injection, not subcutaneous. Okay, primary immunization we give that at 6 weeks. It is compulsory to give DPT or tetanus at 6 weeks, 10 weeks, and 14 weeks of age. Booster doses 18 months and at 4 to 6 years. We give it for all children, and also we give in adults. Okay, if there is any injury that has happened in your body, okay, if there is a cut from a rusted knife or from any rusted instrument, okay, if there is any cut or if there's any injury in your body because of a rusted knife or a rusted instrument, then you have to get tetanus toxoid vaccine. Then next is a typhoid. Typhoid or paratyphoid. This typhoid vaccine is inactivated, that is made from a dead microorganism. The route of administration is subcutaneous. So remember, typhoid we give subcutaneous. The tetanus toxoid we give IM. Okay, then primary immunization for typhoid is we give it after 3 years at any age, 2 doses, and the gap between the 2 doses is 4 weeks apart. And the booster dose is every 3 years. The indication are risk of exposure to any typhoid fever. So in India, typhoid is very common. Okay, so people who are at a high risk of getting typhoid, then they should get typhoid vaccine. Okay, so these are the commonly used vaccines. Okay, then there are some more vaccines. Okay, like typhoid, meningococcal vaccine. Then we have pneumococcal vaccine. These are cellular fraction vaccine. Then there is a plague vaccine, hemophilus influenza type B vaccine or HIV vaccine. Then we have poliomyelitis or OPV, which is very common. Okay, so poliomyelitis or OPV. So this is made from a live virus. Okay, not from a live bacteria. It is made from a live virus. Okay, and the route of administration is oral. Okay, so there is oral. Whenever you see OPV, इसका मतलब है oral polio myelitis vaccine. Okay, then there is also IPV. IPV means that is we give by injection. Okay, so so this is the oral polio vaccine. Okay, so it is made of from a live virus. It is given through oral drops. Primary immunization is 6, 10, and 14 weeks of age. Okay, then booster dose is 18 months and also at 4 to 6 years again, and indication for all children. Okay, so polio is very important. Okay, you must have okay, when you go into third year and fourth year, then you will be going for polio duty. Okay, so then you will be able to give the polio drops to the children and to the babies. Okay, then we also have another vaccine, we call it as MMR. Okay, measles, mumps, and rubella. This is also a live attenuated vaccine. We give it by subcutaneous, not by IM. Then the dose is 12 to 15 months. Okay, the booster is 11 to 12 years, and we give it for all children. Then hepatitis, there are vaccines like hepatitis A vaccine, hepatitis B vaccine, and also there are influenza. Okay, so these are the commonly used vaccines, okay, that are present, that are generated in the universal immunization schedule. Okay, so you have to remember which vaccines, when to give, at which age, okay, how to give, is it by IM or subcutaneous or oral or intradermal, and which type of vaccine it is. Is it a live vaccine, or is it a inactivated or kill vaccine, or is it a toxoid vaccine, or is it a cellular fraction vaccine? Okay, so these are regarding the types of vaccine. So is this clear till here? Anybody has any doubts? किसी को doubt है?
No, ma'am.
Okay. Now, what is passive immunity? So, passive immunity is the administration of antibodies or serum which are containing antibodies to provide immunity against specific organisms. So, like I said, that there are two types. One is active immunity, and the other is passive immunity. Okay, so there are some common immunoglobulins, okay, that we are giving to the patient, or that we are administering to the patient. Okay, so for example, there is a diphtheria antitoxin. Okay, this is made from the samples are taken from the horse. Okay, so the dose is IV. We can give it by IV, or we can give it by IM. The dose is 20,000 to 1,20,000 units. Diphtheria indication, we give it patient suffering from diphtheria or clinical diphtheria. And patient is suffering from clinical diphtheria, then we have to give it immediately. Then there is also another immunoglobulins like tetanus immunoglobulin. Okay, so this is made from humans. It is given at IM. We give it for patients suffering from tetanus. Okay, or if patient or an adult is exposed to any injury or any unclean wounds. Okay, and the treatment we give for 3,000 to 6,000 units. So that is the dose for the tetanus immunoglobulin. Okay, then we also have a few of the immunoglobulins, that is the tetanus antitoxin. Then we have rabies immunoglobulin, anti-rabies injection, anti-rabies serum made from a horse. Then there is rabies immunoglobulin also made from humans. Then we have the gas gangrene antitoxins. Okay, then there is HBIG, that is the hepatitis immunoglobulin. Okay, so these are some antibodies that we are inserting into the patient's body. So this is passive immunity. Okay, then anti-snake polyvalent, that is the anti-venom. Okay, so if there is any snake bite, okay, so we give anti-venom injection or anti-venom vaccine. So these are basically the immunoglobulins, or the serum that we are inserting into the patient's body. And if we insert into the patient's body, then the antibodies will be produced in their body, and it will attack the antigens. Then we also have human gamma globulin, okay, and also we have the anti-RH medicine. This anti-RH medicine, we give it for mothers, okay, who are RH negative after the birth of an RH positive baby. Okay, suppose the mother is A negative, okay, and she has delivered a baby, and the baby's blood group is A positive. Okay, so to prevent any complication further, if the mother wants to have another baby in a few years, then to prevent that complication, we have to give injection anti RH medicine. Okay, Okay, so this this injection is very important, and we have to give it to a Rh negative mother. Okay, just after the birth of the Rh positive baby. Okay, and the dose is 300 micrograms, and we give it by IM. Okay, so these are some of the immunoglobulins that we are giving to the patient. Okay, so these are basically the these are under the passive immunity. Okay, so is this clear regarding active and passive immunity and regarding the vaccines and the immunoglobulins? Anybody has any doubts still here? Second years, anybody has any doubt?
No, ma'am.
No, ma'am.
Okay. So can anyone tell me now that this coronavirus is still going on? Okay, and we're going to the next phase, that is the third wave. So can anyone tell me what are the vaccines that India has been produced? What are the two vaccines that are very important? Who can tell me?
मैम कोविशील्ड
हाँ, एक है कोविशील्ड और दूसरा क्या है?
कोवैक्सीन
Covaxin. Who knows the difference between the two? Who can tell me? Anybody knows the difference? किसी ने कभी गूगल किया है किसी ने? No.
मैम
हाँ,
इनमें से एक एक्टिव होगा एक पैसिव होगा एक में ये होगा कि मतलब एंटीबॉडीज बॉडी खुद बनाएगी और एक में आर्टिफिशियली मतलब वो इम्यून सिस्टम को स्ट्रॉन्ग करने के लिए बाहर से दिया जा रहा है
Okay. So, okay, very good. Okay, and so I would like to explain more about, because now vaccine is very important. So I would like to explain the types of vaccines that generally, matlab universally, many countries have produced many vaccines. Okay, so in India there are two vaccines. We have the Covishield and we have the Covaxin. Okay, so Covishield, we know that it is in India it is called as Covishield, but in United Kingdom or in UK it is called as AstraZeneca. Okay, so AstraZeneca and Covishield are the same. Okay, they have the same. They are made from the same virus, and they have the same efficacy. Okay, same production. Okay, but just the names are different. Okay, so in India it is called as Covishield. It is who knows who which you can see which institute is producing this Covishield. Anybody knows the name of the institute? किसी को पता है? Who is producing Covishield in India? Any lab name? No. Okay. So I'll tell you that Covishield is produced by the Serum Institute of India. Okay, we call it as the SII. So Serum Institute of India, which is in Pune. Okay, so they have presented a Covishield along with AstraZeneca, along with the Oxford University. Okay, so they have decided that they will produce a vaccine. Okay, so in India it is called as Covishield. In UK it is called as AstraZeneca. Okay, so AstraZeneca and Covishield. Okay, these are made from a virus. Okay, that we call it as recombinant chimpanzee adenovirus vector vaccine. Okay, so this is made from an adenovirus. Okay, uh, not from a human being, but from a chimpanzee. Okay, from an animal chimpanzee. Okay, so they did some experiment by taking the adenovirus from a chimpanzee animal, and they have produced the vaccine. Okay, so this is about Covishield. Okay, so Covishield, the Serum Institute of India has presented a recombinant chimpanzee adenovirus vector vaccine. Okay, and their efficacy, the efficacy of Covishield is 70.42%. Okay, we can give it in 2 doses. Okay, and the storage of these vaccine, it is 2 to 8 degree Celsius. Okay, so that was the storage of the Covishield. Okay, and also the efficacy I've already said, that is 70.42%. Okay, and we can give it in 2 doses. Okay, so a gap between the 2 doses can be 3 months, 2.5 to 3 months. Okay, and now coming to the Covaxin. Okay, so Covaxin has been produced by the Bharat Biotech. Okay, this is in Mumbai. Okay, so Bharat Biotech, they have produced a vaccine. We call it as a Covaxin. Okay, and this Covaxin is a whole variant inactivated coronavirus vaccine. Inactivated. Okay, so Covaxin is inactivated vaccine, whereas Covishield is a live vaccine that is from an adenovirus. ठीक है, तो ये difference है. Okay, one is a live and one is a inactivated vaccine. Okay, so both the storage temperature is the same, that is 2 to 8 degrees Celsius. Okay, and the dose also is given to 2 doses, Covaxin also 2 and Covishield also 2. Okay, then apart from Covishield and Covaxin, okay, so there are many vaccines that you should know. One is, then we call it as the Moderna. Okay, Moderna is made from an mRNA. Okay, mRNA virus. Then Pfizer is also made from an mRNA. Then we have the Sputnik V. Sputnik V, this is also from a viral vector. Okay. From all the vaccines, okay, according to the researchers, from all the vaccines, the vaccine which has the highest efficacy is the Pfizer vaccine. Okay, so Pfizer vaccine has the most efficacy, and it is being stored at minus 70 degrees Celsius. Okay, minus 70 degrees Celsius is, these vaccines are placed, they are stored in an area where there is minus 70 degrees Celsius. Their efficacy is 95%. Okay, and it is given in 2 doses. Okay, so this is about the Pfizer vaccine. Okay, so the most efficacy or the most efficient vaccine or the most beneficial vaccine till now, till date, is the Pfizer vaccine. Okay, but it is not available in India, but they are saying that it will be given in India also. Okay, so but you know, for now we have the Covishield and Covaxin. Okay, so as nursing students, you should know what is a Covishield, from where it is being made, and what is a Covaxin, from how they are being produced. Okay, so Covishield is made from a adenovirus. Okay, from an adenovirus vector viral, and from a chimpanzee, and Covaxin is inactivated. Okay, so these are the difference between the two. Is this clear with everyone? किसी को doubt है? Anybody has any doubt with the topic today?
No, ma'am.